have they got it before, but it wasn't enough time, right? So maybe it was the right thing, but not enough of it, or it was the right thing, but the wrong time. So, at different phases in the care, like if you put in like a really aggressive hands-on treatment too early, it's not going to work. It's not that it was the wrong treatment. It was the wrong treatment at that time in rehab. So it doesn't mean that if it hasn't worked before, we're not going to do it completely. But if we're not going to do it at the same time in rehab, we're not going to do it the same way. We're not going to do it, we're not going to try to replicate what hasn't worked in the past. If we think that it can give you a benefit, if we use it in a slightly different way, we'll test it out. And if it does work, then we'll do it.
You're listening to the St. Louis Pain Expert Podcast with Dr. Dave Candy, St. Louis's leading expert in chronic pain relief. Dr. Candy specializes in helping women age 40 and above to overcome chronic, nagging aches and pains without medication, injections, or surgery, so they can stay active, mobile, healthy, and independent. Whether you're suffering from pain yourself or know someone who is, pain's a universal experience that affects us all, but that doesn't mean you have to suffer. Knowledge is power, and having the right information can help you or someone you love get on the road to recovery. On the St. Louis Pain Expert Podcast, Dr. Candy talks with other pain experts from around the world to give you the information you need to recover, the peace of mind of knowing that you're not alone, and the hope that lasting relief from chronic pain is possible, and it doesn't require relying on pills, injections, or surgery in order to do so. So sit back, relax, and open your ears, mind, and heart, and let the healing begin.
Welcome to the St. Louis Pain Expert Podcast. I'm your host, Dr. Dave Candy. I'm here today with Dr. Jamie Bovay, owner of Kinetic Chain Denver, and author of the new book, Adding Insight to Injury. Jamie, thank you for being here with us today.
Yeah, my pleasure. I'm excited.
So can you tell me a little bit first about your new book? This is exciting. It's coming out, I believe, shortly after this podcast is supposed to air.
Yeah, we're really excited. It's kind of a culmination of a lot of ideas that I've had over the years. So I teach other medical professionals as well as treat. And so I think some of the things that I've learned in the clinic, I've kind of went and taught, and seeing kind of the reaction on other medical professionals' faces and how they reacted, I was like, okay, we're on to something here, on kind of something that's interesting and thought of in a different way. And so, while I've been thinking about this a long time, sat down over the last, it's been a long time now, 9, 10, 12 months, and writing it down every day and getting these ideas out here. And, one of my my office managers, she was writing down a bunch of stuff in a journal, and I was kind of like, yeah, what are you writing down? And she's like, oh, these are my Jamie-isms. And I was like, I didn't know whether that was good or bad. And I was like, what are your Jamie-isms? And she was like, well, lots of times you use analogies and similes, and they seem really strange. Like, they're really off. But after you explain them, they make a ton of sense. And so I just started writing those down. And so I tried to add as many of those in as possible, because pain, injury, it's a hard thing to wrap your head around, especially when you're the person in pain. And the simpler you can make it, understanding it, pain's kind of like this, right? And the more you can break that down and simplify the process, it becomes a lot easier to understand. And so this was my attempt at helping people to understand the whole process about injury recovery in a way that's unintimidating, that, covers false beliefs, and just gives them a good idea on how to move forward with getting better and getting back to everything they love to do, even if everything else has failed.
And so you were first talking about medical professionals, but this book's actually written for the people that are going through the pain. Is that correct?
That's correct. Yep. Yeah. So this is for, your average Joe who has had pain for a while, and tried a couple things that haven't worked, and doesn't know where to go next.
And so this gives some people the solutions kind of that they can start to use on their own. And then, I guess if they need further help, they can kind of reach out to a professional after that.
Yeah, I think the first step is understanding, understanding about your injury, understanding why you haven't been successful before. Because if you haven't been successful at several other things, it's kind of like, well, nothing's going to work. Well, it doesn't necessarily that's not necessarily right. The person that tries 3 diets, it doesn't mean they can't ever lose weight. That wasn't the right thing for them. And so, the first chapter is all about false beliefs. So, understanding that the pain isn't coming from where it hurts. Covering that comment, you're just getting old, right? There's nothing in the body that just makes you in pain just because you're becoming old. You don't need an MRI. So covering a lot of those things. The second chapter is what you're doing wrong with your injury recovery. So the things that you're doing that aren't really helping. And then the third chapter is the reasons why you still have pain when you shouldn't. So a lot of it is all about what hasn't worked and helping people understand that. And then we go into each body region and we do a mini version of all of that again, but we also give this is what it's going to take to recover your shoulder, right? This is what it's going to take to recover your neck. But first you have to understand why it didn't work before and what's needed to recover. Then you can actually go about the process of following those directions to help yourself. And then later on in the chapter, we have a wellness chapter, and we have frequently asked questions, how to find the best provider for you, and motivation, a lot of other stuff.
Well, that's great. I'm excited to get a copy of it when it gets released and look through it. It sounds like there's a lot of great information in there, and having information, I agree, is the best way to get started. Now, kind of to reframe, once you have that information, can you tell us a little bit more about what it is that you do in your practice?
Yeah, so we started Kinetic Chain Denver. This is the start of our 3rd year. And, we kind of started it with the idea that we're going to give extended treatment times, be able to be more than just a physical therapist for those people, to be able to communicate in a way that nobody else could, to provide the type of care that nobody else could. And so, we've become a chronic pain expert just kind of by nature. Most of our patients have had pain, medically. Chronic pain is 3 months, 90 days, essentially, anything longer than that. And so most people that we see have had pain for longer than that, and they've been let down elsewhere. They've tried multiple places, and so they've come to us. And then as we have helped those people get better, they tell their friends, they tell their friends. And so we've just grown really rapidly because of our systems and our plans of care for those people that haven't been able to get better anywhere else.
Well, can you tell me what's kind of one of the common complaints that you hear? Is it mostly people with back pain or neck pain, or what kind of patients have you become just an expert in helping?
We see a little bit of everything. We say that we are trying to help the active adult. And so, I realize that can be very subjective. So for a lot of our people, that is, they haven't been able to do it forever, but they want to get back to hiking, or they one day dream of skiing again. But for the other person, it's just, can I walk the dog without hurting for 10 hours afterwards? Or can I play with my grandkids, more than once a week? Because now if I do go play with them, I suffer for, 3 or 4 days. Can I actually go play with them for a couple hours, maybe twice a week, So I realize that active is a little bit different for everybody. But by focusing on what is active for that person and kind of helping them get active in that way, that's where we've really specialized and how we've been able to help people. Sorry, I think I got a little bit off on the topic there.
Oh, no problem. So essentially it just sounds like, active is just whatever that person wants, whatever's going to improve their quality of life and be able to help them enjoy more of the things that they typically like.
Yeah, I think so. And I think, if everybody, the problem with chronic pain is you tend to retreat into yourself because you know that when you're active, it hurts and you kind of suffer and you're not able to do things for a while. But it's everybody's goal, especially if you've had chronic pain for a long time, to be able to do more, right? And so we're here to help people do more with their life. And that ultimately is up to them what they want to do. We don't want to try to get them back to skiing if they don't want to try to get back to skiing. We want to help them get back to what they value.
Yeah, we don't have a lot of skiers out here in St. Louis, but I imagine they're a lot more common out there in Denver where you are.
For sure.
What are some of the common things that people have tried before they get to you?
You name it. I mean, other physical therapists, chiropractors, massage therapists, What else? Yoga, Pilates, myofascial therapists, assisted stretching, Epsom salt baths, meditation. I mean, the list goes on and on. I think the longer you've had chronic pain, the more likely you are to try. As everything else doesn't work, you just move on to try to the next one, right? So, I think, and I'm sure you're going to ask this later, but part of what has set us apart is that we can take the time to listen to that person and figure out what they think will work. So, I think famous surgeon Jay Andrews said, if you just listen to the patient, they'll tell you what's wrong with them, dummy. And so, I think in most systems, people don't have that time to actually sit and listen, to their patient and see what is actually going on, what the patient values as far as treatment, as far as what hasn't worked, what has worked. So, almost everybody knows, hey, look, this hasn't worked in the past, or, what, this felt like it helped a little. And so if we can pick out those things and maximize what does work and not spend any time on what doesn't work, we can really maximize the effects for the patient.
Well, yeah, I know that you do a lot of different techniques, and you do some hands-on work, I believe, in your practice. Is that correct?
We do. I mean, the hands-on is a nice way to affect pain. Now, with chronic pain, obviously, it doesn't always completely get rid of it. There's so many things that can affect pain that aren't the musculoskeletal system. So sleep, emotions, stress, work, diet, exercise, all these other things, they have to be addressed. It's like a giant recipe of soup. You can't just work on one thing or the soup won't taste very good. So you've got to work on all these various ingredients in order to get the ultimate result that you want. So yes, we do tons of different techniques, hands-on wise, massage, manipulation, mobilization, instruments, taping, tools, we use whatever is going to help. And then we try to minimize, obviously, anything that they've had before that isn't going to help. So.
And that's kind of what I was wondering, that I knew you were a really good manual therapist, but you said people, they've tried massage already and they've tried chiropractic. So, even though you can do those, necessarily for the patients who've had that already, that's not going to be your go-to. Or for the people who've had the exercise-based physical therapy, that's not going to be your go-to then.
Well, maybe not. So, have they got it before, but it wasn't enough time, right? So maybe it was the right thing, but not enough of it. Or it was the right thing, but the wrong time. So, at different phases in the care, like if you put in like a really aggressive hands-on treatment too early, it's not going to work. It's not that it was the wrong treatment. It was the wrong treatment at that time in rehab. So it doesn't mean that if it hasn't worked before, we're not going to do it completely. But if we're not going to do it at the same time in rehab, we're not going to do it the same way. We're not going to do it, we're not going to try to replicate what hasn't worked in the past. If we think that it can give you a benefit, if we use it in a slightly different way, we'll test it out. And if it does work, then we'll do it. And during our sessions, we always do what I call, well, I didn't make it up, but it's called an asterisk sign. And it's, okay, we do this treatment. So we pick some movement or something that hurts or something you want to be able to do. We do, and we know that it either hurts or you can't do it. We do a treatment, come back, recheck it. Did it change that movement, or did it change your pain? If it did, then we know we want to do more of that. If it didn't, we know that's probably not a route we're going down.
Yeah, we use that a lot too. And I think that's something that, when people can see how it relates to, their life, that, hey, I can walk longer after you do this treatment, and, I can, reach up to the high shelf without shoulder pain after you do this treatment. And it's a very good indication to us that it was successful, but it also is relevant versus, just, okay, we do this manipulation and,
right.
Well, I felt a little better for a while, but at the end of the day, I can't walk better, or I can't reach up to the shelf better, or whatever else it was that I initially came in to see you with. So that's outstanding that you do that. I kind of want to cue back to what you said a minute ago. And this is a theme that in all the people that I've talked to, that this keeps coming up, is the the right treatment at the wrong time? How do you know?
Dipping your toes in the water, and just part of it is that's one way, but part of it is the more people you see that have been in chronic pain, you build a past history of what you can pull on, right? So, earlier you asked, like, what makes you a pain expert? That question makes me a little bit uncomfortable because I find that I don't want to say that I'm a pain expert, because I think the first time you do that, you get cocky and it comes back to bite you. But what I do have is a history of helping people in chronic pain. And so I now have a library of 10,000 past patients that, hey, this has worked for a person in a similar situation in the past with a similar pain, similar lifestyle, similar stresses, things like that. Let's try it. Let's dip our toes in the water with a little bit of that, see if that helps. And then if it doesn't, then we pull from another patient with a similar past history. So, that, and everybody's different. So you've got your clinical expertise, you've got your history, and then you've got your intuition. And they all kind of blend to see what you think is going to help that patient. So, there is no cut and dry. There is no black and white, especially when the longer it gets from that acute pain, that pain right at first, the more gray area there is. But, also possibly the more in that gray area, you can vary your treatments to get the end result.
Yeah, and you said that after you've seen many, many patients, you kind of develop this past library within your brain, and kind of the terminology expert. It really refers to there's been a lot of research, and I don't know how much familiar you are with it, with expert practice versus novice practice. That experts, they kind of draw on that past history. That novices, they'll do a lot of tests in their exam. And experts tend to rely a little more on their clinical intuition, but then they test it, like it sounds like you do with that the asterisk signs that you were talking about. I think from what you've told me, you absolutely sound like an expert. You mentioned that you've seen people who have tried a lot of things, and that has to be incredibly frustrating for them, to the point that they kind of start to think, hey, maybe I can't be helped. How do you tackle that barrier? Because that's a huge mental barrier that holds people back.
Yeah. So, we, before any patient ever becomes a patient, we have a pretty long phone call on them with them, 25, 30 minutes. And we ask them about all their past experiences. And so, we know what hasn't worked in the past. And we have an idea before they ever become a patient on if we're going to be different than what they've had in the past. Almost always, of course, we would give them something different, or we would just let them know, hey, look, it sounds like what you had in the past is very similar. That's just not been almost ever the case because of our system. We intentionally created it differently. How do you know what's going to work? How do you know why you're different? And I think it comes down to being able to spend the time to listen to the patient. And they are hesitant to try anything new because nothing else has worked in the past. And I think you or I would be exactly the same way. So we have to be able to say, okay, look, this is how we're going to be different. Do you think that might work? And it's up to them. If they do think it might work, if they're willing to try, then we start, and pretty quickly they see results, and then they're willing to go just a little bit farther with us, and then they get a little bit more results, and they're going to go a little bit farther with us. So, I think it's all about, is this different than what you've had before? I think we'd be very cocky to just come in and be like, yeah, you've had this before, but we're just better, And while I would love to think we're better, and obviously I think we are, but I'm never going to use that as a clinical rationale on how we can change somebody's pain when nobody else has been able to do it before. So it has to be, is this person offering something different than what hasn't worked before?
And it sounds like you do a lot before they ever even really get into your clinic to help them make that decision, so that they're not coming in and they're wasting time, wasting money, coming into your clinic just to repeat the same old hamster wheel that they've been on. That they really have a lot of time to decide, before they even really meet you or give you any money that, hey, I think this might work.
Absolutely. Yeah. So we do that phone call, but typically before that, they've downloaded a free report on what they can do for their pain for us. They've read our emails, they've read our blogs. We do the phone call. If that person, if they need more specific or clinical advice, we'll set up a time to talk with a physical therapist. Then we'll come in, we'll kind of chit chat with them in the clinic, and we'll do another 25-minute in session kind of talk, mini exam, give them a diagnosis, answer any questions that they might have, and then just give them more information so they can make a better, more well-informed decision about their health. And I think, and then if they need time, we'll give them more information. It's always just about, when nothing else has worked, of course they're going to need more information. Of course they're going to have to feel more comfortable with you before they're willing to give it a try. They don't know that you're different yet. You have to show it. And so we're all about showing how we're different before we ever ask if you want to become a patient. And we have to think that we'd be a good fit and that we can help you, that the in-clinic session, we're always also trying to make sure that we're the best fit for that person. And that's what we tell them, like, hey, look, we need to make sure we're a good fit. We need to make sure that we can help you and that we want to take you on as a client. And you need to make sure that you want to work with us too before we ever, take you on, or before you ever decide if you want to work with us. It's like a medical first date.
So it's really about helping them out, whether or not you end up being the solution to that problem, or whether you refer them to someone who might be a better solution for their particular problem.
Yeah, and we do that occasionally. Like if it was a serious injury, we'd obviously refer them out for MRI, something like that. If we think somebody else would be a better fit, we're going to let them know, because we rely almost purely on word of mouth and past patient referrals. So if we bring somebody in and they just, rip us around town about we weren't being able to help them, not only did we not help them, but we actually hurt ourselves. So, we have to make sure it's the right decision for not only for us, but for them as well.
Well, that's outstanding. Now, how would someone that, if they're listening in Denver, how would they get in touch with you?
They can call us on our phone number, 720-651-0674. They can go to our website, kineticchaindenver.com. We do misspell kinetic, long story, but so it's KINETIK Denver.com. Or email me. So it's Jamie@kineticchaindenver.
And I'll put all that information in the show notes here, so that if you missed it, you can pick that back up when you get to a place where you can write it down or visit that site. In closing, what are one or two final pieces of advice that you'd give someone who's been dealing with pain for a long time? They just can't get it to go away, and they're starting to become a little bit hesitant that maybe this is just how life's going to be.
I would tell them that things can change. So just because nothing has worked in the past doesn't mean that the right thing won't work for you now. So it's all about finding that right thing that will work for you and finding the right person that can help. Don't get caught down that I can't get better route. And it's easy, especially when everything else has failed, to just be like, well, this next thing won't work. It will. Eventually you will find something that works. If you want to try to find somebody else that's going to help you, find somebody that will spend the time to listen to you, listen to what's worked in the past, listen to what hasn't worked in the past, and we'll come up with a treatment plan that you agree with and that you are on board and excited to go forward with.
Well, thank you very much. Yeah, that's great advice, along with everything else that you've given us today. Thank you for spending the time with us, and I wish you the best of luck in your practice. It sounds like you're helping a lot of people out there in Denver.
Yeah, thanks for letting me do this interview.
We appreciate having you. Have a great day.
All right, thanks. Bye.
Thanks for listening to the St. Louis Pain Expert Podcast. We hope you've enjoyed the show. If you live in the St. Louis area and would like Dr. Candy's help to find a solution to your pain, visit our website at stlpainexpert.com. Email Dr. Candy at dave@stlpainexpert.com or call Dr. Candy's clinical practice, Movement for Life, at 314-941-3970. Movement for Life offers free consultations called discovery visits to people who are serious about discovering how they can relieve their pain and get back to the happy, healthy, and active lifestyle they deserve. If you're listening from outside the St. Louis area but would still like some help, feel free to contact us to learn more about our virtual health coaching. Regardless of where you live, please share our podcast with anyone you know who would benefit from learning more about pain and what can be done to relieve it. And don't forget to subscribe to our podcast on iTunes, Google, Spotify, or your other favorite podcast platform so you get notified when we release a new episode. Thanks again for listening, and we hope you'll enjoy us again soon.